how did being a first generation American affect your career journey? Like, what advice do you have for other first generation American students about to enter adulthood?
Yeah, so um, I grew up, my family's originally from Ghana, West Africa. I grew up sort of all over the world. I ended up moving to the United States from Canada the last 2 months of my junior year of high school. Um, Prior to that, I had taken those moves in pretty good spirit, but I had to say that that was a pretty difficult move to make just because of that time in your life. And I'd really gotten used to my school and had a plan, and it sort of felt like everything blew up. Um, I'm very lucky in that both of my parents have, climbed the educational ladder all the way up. So they did both graduate school level training and postgraduate work. So they were used to school. They just didn't know anything about the United States. So when we moved, my mother was actually relicensing in dentistry. So she was a student at University of Southern California, USC, while my sister and I were finishing, almost finishing high school, and she was, sort of getting through to the junior high time. Um, so, I think that we just didn't know much about being in the US. And case in point, I figured out that I needed to do the SAT and what the SAT was about 3 weeks before it needed to happen. So that was a bit much, but the good thing is that your foundation is what matters, right? So for people who maybe you haven't done your whole educational course here, don't feel um, don't feel self-conscious or feel as though the way that you've been prepared is somehow less than. I think that I was very lucky to have had a very good education, and so it wasn't that hard of a push to prepare for an SAT in 3 weeks, and I did well. Um, do your own independent research. So when you're asking questions, you always come to it. You're able to ask better questions when you have some information. And I think that people are eager to help people who've already helped themselves. Back in the day, that meant going to the library and doing the Dewey Decimal System. And you guys probably don't even know what that means. But now you all have it at the tips of your fingers. So take some time, Google things, get the answers to know kind of what are the things that are expected at each stage that you're in. Talk to trusted teachers, student group advisors, other friends and students. So talking to your peers and also talking to people above you is always key. I think that that's one of the major reasons why I did so well at UC Berkeley. I spoke to people who were above me to give me advice on how to navigate that university, because it's not about your intellect. UC Berkeley is full of salutatorians and valedictorians, and that's not what makes the difference in the success. So me asking other people was what was the key for me in listening to that advice. Of course, talking to guidance counselors. I have to say the ones that I talked to in high school and in college weren't necessarily that encouraging, and they kind of put me in a box, and they didn't think that certain things were going to happen for me, but you still need to talk to those people because they at least can give you some of the information, whether reluctant or not. You ask them for the information. Ask questions when you don't understand. When it's a different system, you might feel uncomfortable and think that you ought to know something, but you can have major gaps and miss major things if you don't just ask the question. So don't just pretend you know what's going on. And I think those would be the major things that I think helped me in my journey. Even though my parents didn't know this system.
I love what you
Oh,
said.
one more thing. Actually, let your parents advocate for you. You know, share with your parents the information that you have, and bring them into those conversations. Because once you give them that information, there are a lot of things that they know, and they can help push and advocate for you.
I love what you said about asking questions, because that's something I had to learn. When in high school, I was struggling horribly until I started asking questions, like to people above me and like counselors. And I thought I could figure it all by myself. And I love that. And I feel like a lot of people in here also probably have that type of struggle where just asking a question is like, it seems simple, but it's a lot to it. It's a lot of benefit to it. But next
Yes, that is
question,
the key.
it is. It is. And the next question I wanted to ask, so we've seen a lot of TV shows and movies about doctors and that becoming a surgeon and the grueling years of training. And I wanted to ask, what is the difference between the perception and reality in the path to becoming a doctor? And what do you wish you had known starting out?
Well, for one, I wish residency and medical school was as glamorous as it is on television. It definitely is not that glamorous. But, in terms of the parts about hard work and it being a really long journey, those parts are real. I think sometimes when you watch a television show, they don't give you an honest picture of what it feels like to be an intern. An intern is a first year resident, and the responsibility is graduated. You don't just roll in there as an intern and just go do a hard thing. Um, it is scary. um, it is scary. I think that the biggest changes between college and medical school for me, first of all, was to realize that it kind of wasn't okay for me to cram anymore and do things, because the knowledge, I needed it long term. So that was a big transition from college to medical school. Then the next transition is becoming a resident and being actually, it really is you who's responsible for a life. And you realize, oh, so if I calculate this thing wrong, I could potentially kill this patient with this medication. And so that's another whole different level of fear and, anxiety. Then you become a resident. And I think one of the most confident times of my life was my chief year, and just so smart and everything, you're in charge of a resident team and you know everything at the tip of your fingers and you're so confident. Then you become an attending, meaning that you are responsible for your own patients and you are shaking in your boots again, because it is very different to be a chief resident and be the top of the totem pole of residents, but you always have an attending. You had somebody behind you who was really responsible. So once you are responsible on your own, that's a whole different level. The things so I kind of already told you that pathway for me, that was 17 years of school, right? Going from undergrad through fellowship. So it's a marathon. It is a marathon. It is not for the faint at heart. You want to really do this because you sacrifice a lot to do this. So this is not just, I like the prestige of being a physician. I don't even know if it's as prestigious anymore, but this is, you do this for love because it's not always fun. You are going to do standardized tests for the rest of your life. You're going to learn and be tested for the rest of your life. I don't think I really realized that, but it's true. One other thing I think I wish I would have known starting out is that I wish I would have understood the emotional toll that can come with caring for people, being a physician. I think I wish I had understood that a little bit better.
Yeah. Okay. So you mentioned this a bit ago, but in a profession that literally deals with life and death, how do you still how do you stay motivated in those moments where it's literally, if you do something wrong, it's their person's life?
Yeah. Um, it's hard. Um, you know, part of it, you do have to make decisions about what area of medicine is for you. And I think this can be applied to many careers, right? So I did realize that I didn't want my patients to die all the time. So, and oncology, dealing with cancer side of medicine was not for me. And I knew that also, same thing with trauma surgery, there's a lot of patients who don't do well. And also the constant anxiety of being a trauma surgeon wasn't for me. So I thought about it in choosing my specialty. And luckily in plastic surgery, yes, there are many times I can definitely make life or death decisions for patients. But luckily, most of the time, I'm on the happy side of things. So reconstructing people, I'm usually on the happier side of things. When things go badly, first of all, you have to mourn. And I think we're doing these things better now in medical school. But there's so much to learn in the field of medicine. I remember I experienced my first deaths. It was actually 3 deaths, back to back, the same call night, when I was a medical student, in the emergency room. And no one said anything. I could tell the weight on the whole team and that it was a hard day, but no one said anything. And I really only processed it several weeks later in one of our other courses that we took, where we would talk about our experiences, and they had us write about a difficult experience. And that was when I mourned. I went through and actually emotionally processed it and mourned it. So, first of all, mourn. Don't hold it all inside. Talk about it openly and honestly with peers and people that you trust. Review your actions and fairly assess where you could have done better. And if you can do that, sometimes you find that there was nothing you could really do, but then there are times that you say, okay, these pieces I could have improved on. And then this is the hardest part, because you always focus on the negative and spend time beating yourself up. So take a step back and look at all your other patients and remind yourself about the good that you do in the world, because we beat ourselves up for the 5% that goes wrong, and we don't give ourselves very much credit for the 95% that goes right. And then eventually you have to get back on the horse, you can acknowledge that you're afraid, but you have to go back in the OR and do it again, if it's was a very bad experience. Sometimes you start with things that are easier, more predictable. You might phone a friend, meaning you call a colleague in with you. If you are going back to something really, that scary situation or something similar to that really bad experience, but you have to get back on the horse.
I love that. You have to keep going. And I just can't imagine that type of just, I don't even know how I would process that, but I really enjoyed how you said, like, to take what you could have learned and just move on from there. And you can't stay in the same place. You can't move forward unless you realize that you did all you could. So the next question I wanted to ask, according to the Association of American Medical Colleges and Medical School faculty, particularly those at your level, are still predominantly male and white. What has your experience been like navigating this as a Black woman?
Yeah. um, it can be challenging. Okay. I'm not a sugar coater. I'm a pretty straight shooter. Um, the facts are that 3% of all faculty in US medical schools are Black. So to give you some real numbers, in 2016, probably about 579 actual full professors. That's sort of the height that you can get in academia. 579, literally, the whole United States. And people at my level, in that year was 714 associate professors. Right now, we have about 3.8% of plastic surgery residents are Black. And once the higher you get up, the more it's just, so if you're looking at leadership roles in academia, it's 2%. And then if you look at who's leading national societies, who's editor-in-chief at journals, it's 0%. I am the first Black woman to complete training at the Harvard Plastic Surgery Residency Program. I was shocked to find that information out when I started the program, because I just didn't realize that there were so many firsts still happening, and it happens all the time. All my friends are firsts, it's all the time. And I'm excited and sad to say that this year in the Harvard Plastic Surgery entering class, they have 2 Black women and 1 Asian American woman. And literally they are number 2 and 3 since me. So it's amazing. And I celebrated it and all of that, but also it's been almost 10 years. I finished training there in 2012. So you have to, you're going to be a first, and you have to wrap your head around the fact that you will be lonely sometimes. And that is okay. You can't afford to dwell on it. I think that it's important to know that when you're a person of color, and this is again me being the straight shooter, if you are in that space, you probably had to work much harder to get there. These are just facts. Okay, so you have to try to remind yourself of that when you feel less than or are othered, which just is something that happened all the time, and it still happens to me all the time. Nobody is expecting their plastic surgeon to look like me. They just don't. Some of them are very excited when they figure that out, but I encounter that all the time. You have to find mentorship and sponsorship in diverse people. So the people who are going to mentor you and sponsor you may not necessarily look like you. And that's just okay. And that's what it is right now. As the years go along, I hope that changes. But there were, when I, especially as a medical student entering plastic surgery, I had 4 older white males who thought I was the jam, and they supported me and made it possible for me to get to that next level. Could I bring all of me to those mentoring relationships? Not necessarily. You had to seek out different people to get those pieces. You can't get it all in one place. Don't forget about, and you're going to need many mentors and sponsors. And then don't forget about your peers, your peer mentors. You are going to be each other's support systems. You are going to be sometimes the ones who facilitate in finding a position or doing a lateral move or just advising. So don't forget about those relationships.
And the next question is kind of related to what you are saying, but what would you say is the toughest thing you learned in your career? Would it be that you're the first for everything? So what would you say would be like the toughest thing about it?
I would say, my husband is here and he's just in the background.
That's fine.
It is. I just had that Zoom moment. I'm like, here it is. Okay. I think I learned as a physician that I could not fix everyone, and that I am not necessarily the only person who can care for a certain patient. you're not always the right fit for it, for everyone. And that's not to say something bad about the patient. That's not to say something bad about you, but sometimes you're not the best person. And this applies broadly in life, in other careers. Sometimes it's just not the best fit, and that's okay. And you shouldn't take that as a personal affront or in some way that it diminishes you. Um, you know, I think the other thing that I would learn is that doing the right thing is not always easy, and it does not always show immediate rewards. So doing the right thing or speaking up, or you may not reap the rewards right away, but you should do it anyway. You do it for your soul, and you do it because the arc of history is long. Yeah, I think those are things I've learned.
Like that. I like, for me personally, I want to go into something that'll be beneficial for the person and doing the right thing. And I learned from a mentor I actually had. She was like, sometimes you do the right thing and something bad might happen, but your intentions were there to do the right thing. And I know you experience a lot of that as a surgeon. So next question is, as part of our Urban Alliance experience, we're all practicing and interviewing and we're advancing our communication skills. And as a professor, you have a lot of experience speaking in front of an audience. What tips or tricks can you share with us to become more confident public speakers?
Okay, first of all, am I doing okay?
Yes,
So far
yes,
today? Okay.
yes, we love
Um,
it.
I think Thank you. Okay, so I think that you should know your audience. First of all, try to get a sense from the person who invites you, or try to get a sense of what the situation is, meaning that who is in the audience, what are they interested in, why are they there? I believe that we're doing questions in the chat box. So if you could ask the question that way, it would be great. So get a sense of who that group is, and you are going to have to tailor what you say slightly. And remember, we do this every day, right? The way you speak to your parent versus your teacher versus your sibling, versus friends is different, right? So you can tailor it to that audience while remaining your authentic self and using your authentic voice. I think that part is very important, because when you're using a voice that's foreign and not authentic to you, it is harder to communicate and you're more apt to freeze up. I mostly, when I'm speaking, I know my big ideas and concepts, and I try to speak more in a conversational tone. But of course, if it's a major speech or, scientific presentation or something, major speech, you do have to memorize. But if you're using your tone, then it's not as difficult to do. And if you go slightly off track and don't say the words in the exact order or the perfect word, you can easily insert something else, because it's your authentic voice.
That makes a lot of sense. We can definitely see the authenticity through the screen. We all can see that this is truly you, and the conversational tone just helps with everything. And that's what I've been trying to do personally more of. And so I have one more last question before we go into our fun lightning round. And the question is, what is the best piece of advice you've ever received in your career?
And by the way, thank you guys for sending me. They did send me my questions, and I did review them as part of my homework before doing this. So best pieces of advice. Find mentors and sponsors. And what is the difference? A mentor sort of will guide you, might give you information, but a sponsor is somebody who has your name in their mouth. So they're the person who's going to say, oh, I I know exactly who we should ask to do this. It's Kiwan, you know. And that's something where it does get more challenging as you get higher in your career. And I'm facing that right now, for myself, realizing, okay, I don't really have sponsors, and what does that mean, and where do I want to progress next in my career, and how do I do that? So this will be a constant thing in your career. Never put your career into someone else's hands. And again, these are all conversations that I am having with myself and other people are having with me, right? So a lot of times it might not even be true, but you think that your success or ability to progress is tied to someone and they are not letting you do this thing. It's actually not true. You have choices and you have ways to position yourself and move to something else or somewhere else, you know. Learn to say no. And this is one that I have problems with and I am working on. That you have to understand your limitations. And if you are completely spent, and are not well, you cannot, you're no good to anyone. So you have to learn to say no and really start to analyze opportunities and learn when you are overstretched and you cannot do something. And you can tell somebody, hey, you know, can we can revisit this in a year, 2 years. There are ways that you can be subtle about it, but you have to learn to say no. And then do not forget to schedule yourself in your life. I, you know, I tend to cancel myself for other people and other things and work things. And so I've had to learn to put myself on my schedule, my workout, my massage. And when you ask me, I'm going to look at my calendar and I'm going to tell you, no, I already have another obligation. I already have another engagement. And don't cancel yourself and so meaning your family, your personal life.
Thank you for that. Okay, so before we do our Q&A, we're going to do a quick lightning round. It's going to be 60 seconds, and I'm just going to ask you a question. You just say whatever comes to mind. And these are more fun questions, more lighthearted questions. So, okay, are you ready?
Yes.
Okay, so starting off, what's the best book you've ever read?
I would say 2. It would be Beloved by Toni Morrison. And to show that I'm a little quirky, I like the Hobbit and the Lord of the Rings books.
Okay, what's one thing you can't live without?
My calendar.
Personal theme song or just your favorite song?
If I'm trying to get myself going positive for a day, it would be Lovely Day by Bill Withers. But my jam is Poison by Belle Biv DeVoe.
One food you could eat.
I don't know these songs, by the way. But
I know Bill Withers. I know who Bill Withers is. But what's one food you could eat forever?
Popcorn. I'm completely addicted to popcorn. Yes, it's a thing.
Last TV series you binged?
I think it was Lupin. It's on Netflix and it's French and he's sort of, I don't even know how to describe it, but it's not even really a mystery. I don't know. He's like a gentleman thief. And I am trying to practice my French and strengthen my French. So I've been trying to watch shows in French.
I don't know why. I was expecting Grey's Anatomy. I was expecting that answer, but that.
No. I haven't watched Grey's Anatomy in years. Yes, but there are other things that I've been binging a lot because I've been on vacation for this is like I had 2 weeks of vacation, so it's been amazing.
What's your favorite part of your day?
Anytime I walk into the door and I see my 2-year-old.
Favorite movie of all time. And who's your personal hero?
My mom, everybody says this, but my mom's my personal hero. She's someone who started over so many times in her life. She has just weathered so many obstacles and taught me so much about being a woman and being strong. So my mom all day.
I love that answer. Favorite place in the world?
Any beach, and I'm at the beach now. Any beach, especially in Ghana. That's where my family is. That's where I'm from originally. But any beach goes. Just about any beach.
Phone app that you use the most?
My calendar. After that, maybe Instagram. I don't know, but I am so calendar dependent. And if you're not on the calendar, I will unapologetically be like, yep, nope, not there. Sorry. Have to be on the calendar. So yeah.
Okay. Thank you for all those answers. So now we'll take a few questions from the students, and please forgive me if I pronounce anyone's name wrong. So first up, we have Jocelyn Dozier from Detroit. Please unmute yourself and ask your question.
Hi, my name is Jocelyn Dozier, like you said. My question is, what is the most rewarding part of your day as a plastic surgeon?
Oh gosh. I think that whenever you bring joy to a patient, so when they are seeing their results, sometimes for some patients, they see enough of a difference that first post-op visit. Sometimes for patients, it takes longer because really the healing process is longer than that, but when they finally see themselves, it's huge. Right now, I'm doing a lot of transgender top surgery, which I enjoy immensely. And I have to say that has been so rewarding because my patients are so happy. And it is often on that first post-op visit, just having that chance to help someone become in alignment, feel in alignment with themselves, and show their true selves is spectacular. Anything in the OR is also awesome.
Okay. All right. Thank you. Next up, we have Samaya Scott from Chicago.
Hi. First, I just want to thank you for attending this meeting today. All Believers Like Me has been amazing, but this one has been like the most amazing one. My question was, being a high school graduate and going to college, did you always know what career you wanted to go into growing up, or was it like you just know as a dream?
Wow, that's an excellent question. So my mother is an oral surgeon. Oral surgeons usually are like dentists who've done additional, more surgical training. She told me not to be a dentist, but she did not tell me to be an oral surgeon. And to be honest, it never really registered to me for a long time that my mom was a surgeon. I thought I wanted to be a doctor by the time I was you all's age. So I did go into college, pre-med, and also doing a biology major, but I intentionally investigated everything else while I was in college. So I taught high school every Friday at a local high school. I taught African American history and literature and Black male female relationships. I did research, so more bench type research. I did a lot of community service, through the various organizations that I was a part of. So I basically investigated just about everything else. And I came back to the conclusion that medicine was the thing that was going to marry all of those things together. So I've sort of been a person who at every step along the way, I've felt relieved that I do indeed love this and it's what I wanted to do. It's the same thing with surgery. I was actually pretty sure that I was not going to be a surgeon because surgeons had bad attitudes and bad lifestyles. but I took the most challenging surgical rotation in medical school, and it was very clear, it became very clear that surgery was the way that I was going to go. So always staying open-minded. You don't know what your pathway is going to take. So I do think it's important to stay open-minded and be willing to change your mind.
Thank you. That's an amazing answer.
You're welcome.
All right. So for next question, it's more of a personal, it's my own personal question. And I said, what has been your greatest accomplishment as a surgeon?
Oh, gosh, I do have to say that it happens a lot. I will say it's interesting that you ask as an accomplishment, because I don't know that it was really me who accomplished anything, but when I was in training, I participated in 3 face transplants while I was in training. And so that was a huge opportunity. It was those are life-changing experiences for everyone involved. And so those 3 transplants, I think, had an immense effect on me. Although I wouldn't call it as my personal greatest accomplishment. I think anytime that you teach students or residents and they tell you that they want to go in a certain direction because of their experience with you, that's huge.
Personally, I think that's huge. Face transplant sounds like that's in somebody's entire identity. I think that's amazing. And to wrap up, what is one thing you like us to remember from today's conversation?
Your personal life is just as important as your professional life. And take this from someone who has been, trucking down that pathway in a very focused manner. Yes, you can't control everything in your personal life, right? But don't create artificial boundaries, or, don't put yourself in a box. Don't forget about the importance of you and your personal life. You are a whole person, and you cannot just focus on your career only. For most of us, for a lot of people, as you get older and you're going to start looking back at your life, you probably will not and do not want to be defined by your career alone. So don't forget about your personal.
I completely agree, and I love that. So thank you so much, Dr. Kpodzo. It was an honor to speak with you today. You were actually my favorite out of all the speakers, leaders like me. And now I'm going to throw it back to Miss Margaret to close us out.
Thank you.
Dr. Kpodzo, Kiwan, interns, thank you so much for such a thoughtful and inspiring conversation today. And just thank you to everyone for coming to our 5th Leaders Like Me event. So remember, next month, we'll be celebrating the Urban Alliance class of 2021 during our culminating regional awards events. So we hope to see you there. So thank you again, everyone, for attending. This has been amazing. So take care and have a great evening.